In the U.S., Johnson & Johnson has now begun shipping nearly 4 million doses of its newly authorized vaccine. Canada is expected to follow suit on approval in the coming days. That is significant because this shot only requires one dose. It is easier to transport to remote areas. And as Jackson Proskow reports, it appears to stand up to some of the more contagious variants that are causing so much concern.
Rolling off the line, one shot that could change everything. The Johnson & Johnson vaccine needs just a single dose, not two. And unlike its rivals, it does not need ultra-cold storage. Epidemiologists see it as a breakthrough.
That is going to be really key to reaching those populations that are traditionally harder to reach because they just don't have the best access to healthcare and they're in locations that don't have infrastructure.
In clinical trials, Johnson & Johnson says its vaccine prevented all deaths and hospitalizations and held up against the virus variants that have raised so much concern.
Whether it was the South African variant that we know is particularly challenging or the P2 variant in Brazil, our vaccine showed 85% effectiveness in severe disease, and it kept all the patients out of the hospital and from dying.
In Canada, the vaccine is still pending approval. Up to 38 million doses are on order, and Health Canada expects to make a decision soon.
There was a last piece of some of the manufacturing data that we were expecting, and we received that on Saturday. So we're expecting to make a final decision within the next couple of weeks.
Timing is important in both countries as the sharp decline in cases seems to have stalled. In the U.S., the CDC director warns of a looming fourth surge.
At this level of cases with variants spreading, we stand to completely lose the hard-earned ground we have gained.
Having yet another vaccine is perhaps the best defense, but it also raises the risk that a skeptical public will go vaccine shopping, looking for one specific shot. Public health officials caution against that and say that any vaccine that has been approved is successful at its primary goal of keeping people alive and out of hospital.